Look, we've done a lot of work with Access this year, and I'd like to thank Basil and the team that have taken us through, especially with Dale and Will and Jesse, a whole heap of different solutions that we saw. We had customers looking for options at a low cost end that could maybe, instead of spending $30,000 upgrading a parking system, they could put in something that might cost a fraction of that to get the ability to do a reservation system rather than integrating into the car parking system. Or it might be that it's a standalone solution at a commercial car park that isn't taking any money. And we've been looking at some options along with the app that we use to come up with a solution that's low cost that can plug both QR code and license plate in. And Basil and the team were able to come up with a great solution that we're now using at SAN. I'll hand over to you, mate, and you can talk about some of the stuff that you're doing in the health as well. Yeah.
Thanks, Mostyn. Thanks very much. Good evening, everybody. How are you? You well? Yeah. Yeah, this is a different crowd to the last time I was here. I was up in the nosebleed section there watching an Oasis concert a couple of weeks ago. So I think it's not going to be as crazy tonight. But yeah, thanks to the guys at Ubi for organising today, and thank you all for attending. So as Mostyn introduced, my name is Basil Delimitros. I'm a key account manager for new business at Access Communications. I will take you through who we are. I'm going to be the guy you're going to thank a bit later on because I've got a couple of videos. You're not going to listen to me talk, and I'm going to try and finish early as well so we can get on to the next session. Okay? Thank you. Thank you. But before I do that, I just wanted to, I know we're in it's been organised by companies that are in parking, but are you all in parking? Yeah? Anyone not in parking? Fantastic. All right, you're my audience, buddy. No, look, I've got some videos here, and we're going to go into a vertical market that we have in healthcare and hospitals. But I want to try and draw some parallels across those industries because you see, a lot of people know us for security and surveillance equipment. Okay, now I'm just going to give you a bit of background about who Access Communications are as well while we all this sort of stuff. Can I have a show of hands? Anyone know who Access Communications is? Yeah, you do? Jeez, it's all right, isn't it? Okay, so yeah, we're a 40-year-old organisation. We're an inventor of pretty cool tech as well. So, you know, and I'm going to show you some of that information, but I want to just share with you what I think is the most important thing about what we do, is that we work through partners and partnerships. So in this room, we've been working with the guys at Ubi, and there's others in this room as well, who leverage the technology that we create and build vertical solutions. And in this case, we're doing parking solutions. And in the case at the SAN Hospital, Dale came to me for a particular solution. We designed 2 different types of systems, and oddly enough, we're using an intercom to act as a QR code reader and an access control system. So if you know about us because of the products that we do, just know that we're not about product only, we're about what the use case is and building a solution around that. So our organisation is headquartered in Sweden. We are a Swedish company, but we're owned by Canon. There's 5,000 people around the world, and what we have is 37 experience centres around the world as well. But let's talk about Australia and New Zealand, or let's talk about Australia. We are an operation of over 60 people across Australia and New Zealand, with offices in all the major capitals across that region. And we have what we call an Access Experience Centre, and that's where we designed the system for the SAN Hospital over there. And there's an open invitation. If you're in Melbourne or Sydney, we have an Access Experience Centre in those towns. you're more than welcome to come and have a look at the technology and imagine what you would like to use yourselves. Okay, so most people know us about our network cameras, and I'll talk about some of those venues as well. But we're also the inventor, the inventor of network audio. So we have speakers on the back of network ports on the back of speakers. And we have a whole range of infrastructure solutions that will go out that we can talk about in the marketplace. Let's have a look at who some of our customers are. If you walk around Melbourne City Council, look up, you'll see our cameras. If you've come to this venue or the MCG, look up, you'll see our cameras. If you drive a car, look up, you'll see our cameras. If you're on a train, look up, you'll see our cameras. And if you're in jail, look up, you'll see our cameras. I'm not advocating go to jail or anything like that, but we're in there as well.
Yeah, that's right.
Yeah. Sorry. Okay, so today, like I said, I want to try and draw a parallel in the industries that we're operating in. We're across a lot of them, as mentioned earlier. But I think what I'm taking out of the presentation that I heard earlier today is that parking is a fundamental operation. Get into a car, you want to park your vehicle somewhere, you've got to make it to a parking spot. But what we notice about today is finding a parking spot is easier, paying for a parking spot is easier, and there's less friction through the whole process. And like what we're going to show you with the day in the life of Nurse John, we're going to show you how you can interact with technology that could be a security camera, but I want you to think about these things as not being security devices because they're not. Like we mentioned, an intercom is not an intercom, it's a QR code reader. Okay? I'll talk about some of the challenges that are faced by healthcare providers. Like I said, we've got the video with Nurse John. We'll recap Nurse John and we can talk about some of the products that enable the use cases as well. All right, we all good with that? Yep. All right, so we're going to pack it into the next 10 minutes. 15.
If you can help me out with some time, mate.
I will, trust me. All right. Hospital, healthcares. Yep, good. We're in your hospital too, by the way. Okay, so there's a lot of use cases in hospitals, but and if there are more, we'd love to hear from you and learn as well. But when you boil it all down, hospitals and healthcare providers have three main concerns. One is quality care, providing good quality care to people who are in distress. Okay? They want to provide safe and secure environments for the staff, for visitors, for patients, contractors, whoever it may be, and also provide drive efficiencies through, and they can do that with technology. We'll show you some of those. Now, the challenges that healthcare have, I see this without my glasses, is there's a lot more hospitals being built because we have an aging population. And, sorry, my eyes are not as good, I better look over here. And you know, there are more hospitals being built, there are more staff, and if anyone deserves a medal in this world, it's those healthcare providers, because they do stuff that I could not imagine wanting to do myself. So they need gold medals, those people. But there is high turnover of staff, so they've always got to constantly retrain people. But I suppose as we transition into a digital world, there is a need to get more systems connected, these disparate systems connected. And they could be from patient monitoring to nurse call systems, and indeed parking systems. They've all been disparate, but there is a need to bring them together because they are related in one way or another. And that could be because they're trying to drive those efficiencies in process and what have you. Very similar to your industry, the parking industry, where you want people to pay up front, but you also want them to be able to exit and a car park easily, but also find a parking spot really easily. Okay, so let's have a look at what a day in the life of Nurse John looks like.
Imagine a typical day in the life of a hospital nurse where innovative access video surveillance and connected technology make every moment safer and more efficient. A day that revolves around smarter, safer patient and staff care. Our story begins as Nurse John arrives at the hospital. In the staff car park, Axis Vehicle Access Control seamlessly manages entries. Cameras equipped with Axis license plate verifier analytics ensure authorized access, while a video intercom adds an extra layer of security. Inside the emergency department, Nurse John's shift starts. Access control plays a crucial role, allowing him to enter secured rooms swiftly. The system maintains a visual record of every entry, providing peace of mind for staff and patients alike. In the emergency waiting room, an incident unfolds. Thanks to Axis sound detection, the situation is quickly identified. Security is alerted as someone becomes agitated, ensuring a rapid response to de-escalate the situation. As patients' stress levels rise due to long wait times, Nurse John wears a body-worn camera. This staff safety device helps deter bad behavior, protect property, and document incidents, ensuring both staff and patients are safe and secure. Meanwhile, patients are admitted into the hospital. Remote patient monitoring stations equipped with Axis cameras and two-way audio capabilities offer peace of mind. When a patient coughs, the system automatically sends a calming message, "I can hear you." A nurse is on their way. Nurse John is paid to assist in the theatre. Whilst in theatre, Axis camera can facilitate remote specialist consultations and support doctors in training. In a nearby room, a patient attempts to get out of bed. Visual alerts are sent to the nurse's station, allowing for a proactive response. Staff arrives promptly to prevent a potential fall, maintaining patient safety. Securing medications is crucial. High-resolution cameras and access control systems protect prescription medication and valuable assets. An audit trail ensures medicines are properly accessed, dispensed, and disposed of, reducing the risk of diversion. As Nurse John's shift comes to an end, the hospital's commitment to safety extends to the parking area. Axis Vehicle Access Control ensures the safety of the staff car park, allowing him to leave feeling safe and secure. And, as he exits the car park, the added security of SOS stations offers peace of mind. These stations rapidly connect users to security dispatchers in case of emergencies. Our innovative video surveillance and connected technology ensure that every moment in a hospital, from arrival to departure, is smarter and safer.
Okay. Now, I was just hoping that some of that resonated with you in that automation, in that animation video, particularly around the parking, because you can see that the animation is actually a reality today as well. So if we just do a quick recap about the day in the life of Nurse John. See, Nurse John arrived at work, got in really easy. There was an LPR that opened up the boom gate. Then you had the intercom for an additional layer of security, so you can have multi-factor authentication. Very similar to what you're probably already doing today. Checked in with access control, and his day starts. Now, these are all interactions with technology, so they could be seen as security devices, but they're actually use case enablers. Okay? An incident unfolds within the emergency waiting room, and they were able to detect that with an acoustic sensor that's inbuilt to a camera. Security was alerted, and they were able to deploy a security guard wearing a body-worn camera. So the whole idea is that Now, the body worn, it is there to reduce stress in the environment. You also saw the ability to have two-way communication with a patient who was in distress and try and soothe that person and calm them down. But then moving along other concerns, there are the protection of people, property and the assets or the drugs, and provide a proper audit trail with these digital systems. At the end of it all, First John goes back to the car park with an escorted walk back to his vehicle and has the help point. Again, this is not all about animations, it's about real life. So I'm going to quickly run through some of these, knowing that I've got very little time. I want to be cognizant of that. And you see, we don't need to talk too much about license plate recognition because we know it's already there and already there. Noise detection is a real technology today where it doesn't listen to conversations, it listens to noises and grabs the metadata, creates an alert back to a control room or a nurse station. Now we've seen body-worn cameras around in many walks of life now, and normally associated with security guards, but can also be used as a customer service device, as in the pebble-shaped camera there. But I want to just spend a little bit of time on this one because this camera here was developed with the help of our customers in the United States. And the purpose of this was to monitor the rooms. And they've got a whole bunch of features in there, which I've got a couple of other slides that will illustrate these features, such as the haloing out or blurring out of people in images. I noted Babu mentioned about blurring out faces in his camera technology. We do that and whole bodies. But this is a product that can be used for telehealth solutions. So you don't have to be in the hospital or the doctor doesn't have to be face to face. You can have two-way video consultations. It's a camera that's also now been certified for use in MRI rooms. Two things I want to highlight. The heartbeat in the top right indicates that is a live image. Okay, so if you've ever had the pleasure of being in one of these MRI machines, they're very claustrophobic and people can panic. So now with that camera, an operator can be in the other room and have a two-way conversation and let them know that everything is cool or just be present. The other thing I want to point out is that cross line on the floor, we can trip an alert if someone crosses over that line when the machine is on. Yeah, so some nice features here, the live privacy shield, and that is the blurring out of the subject, or in the reverse, their work environment. Okay, so that's technology that's available. I'm not going to play the whole video, but if we're talking about hospitals in particular, this is the reason I wanted to show this is that we do have development companies that work with us to enhance our solutions, and we work together in selling solutions together. So in this case, a company based out of Canada has built an enhanced fall detection technology. It's so smart that it only needs to get half of your body to determine that you're a person. And it's also so smart to know that when you're lying down in a bed, you haven't fallen over. Okay? But the alerts are there. If you do have a fall, it will alert the nurse station. Okay? Won't spend too much time on that, but I will play another video, the protection of assets and drug counters. So again, this company does what we call markers. And here we go. In a hospital, the assets of drugs, if you have a policy that means that you have to have two people in the room to open up a cabinet to get the drugs out, then everything's cool. But if there's only one person in the room and the door cabinet is open, it again will create an alert. I think you saw that. Pretty clever, isn't it? Yeah. Okay. And just another, yeah, here we go. Another use case in the hospitals. Again, this is feedback that we get from customers and consultants alike. Is they say, hey, can you tell me when there's a car that's parked where the ambulances should be? And we go, yeah, absolutely we can. So we see technology today will allow you to do object detection in an area. So now what we can do, I don't want to do a helicopter because that's a little bit far-fetched, but we can tell you if there's a car parked where an ambulance should be and create an alert to a control room and to the nearest station, or play an automated message on a speaker to ask that person to remove themselves from that area. The technology today is even smarter, where it can analyse a scene and it can describe the person in the scene as well. So we're running an analytic in our office where, unfortunately for this person, it said, there's a bald, middle-aged man holding a mobile phone in a restricted area. Can you please remove yourself from there? And we're demonstrating that today. And that's all about connected devices and connected systems. Can do that. We are getting to that point. Now, the intercoms, we've talked about one use case where we've got QR code reading, but we've also had use cases where these are being used for enrolment of temporary staff or contractors. Because as an intercom, this is a very expensive unit. But if you can find more uses for it, it's a better solution overall. Again, we have network speakers, and last but not least, environmental sensors. Now, all these technologies talk to each other. They can create an alert from one device to another. So it really is up to your imagination how you want to use technology today. And I'll leave you with one question, and is that, what does the room of the future look like for you? Okay, so thank you very much, everybody.
Say, mate, have we got any questions for Basil?
I've got a comment.
It wasn't about you, by the way.
I'll pause. Pause. No, anyone who wants to, when he was talking about the Experience Centre, I've been at the Experience Centre in Melbourne. When we were looking for a solution for the sand, we went down there with the team, saw everything that was there. We sat at the desk with the techs, came up with a solution, and it was amazing.
That's a good comment. Is there any questions? Jen?
What's the most exciting part of your work at the moment? What's getting you most excited?
I think what I've enjoyed over the number of years is breaking the mold. Because, like, if you think about security and surveillance cameras, what I didn't share with you, I've been involved in technology for over 30 years, but the last 20 years I've been selling security and surveillance. And in that time, our discussions have evolved from, I better put a camera over there so I can see what I need to see, just in case something happens. But today we're actually selling for a whole different use case. We're gathering information, we're gathering data. We are now contributing to what we used to call years ago the big data pool. Okay, and we're creating these wonderful tables of graphs that we can use to do aggregation, accounting, occupancy, adding to car parking solutions. So you know how many parking spots are available. Or if you want to know how many people pass through an intersection at any one time, you know that. So I think it's really, the exciting part is how do we use technology to solve different use cases. Now, what I would love to do, anyone here from Point Cook?
Yo.
Oh, you are?
Yeah.
Okay. Good. All right. Well, hopefully you're not the driver. We have a shopping centre where some people turn annoyingly right where you're only supposed to turn left. I'd love to put a camera there and use that. Will get me excited to bust everyone who's doing the right hand turn illegally because yeah, I think the other thing that is exciting is how to really get connected into internet connected systems and use AI for positive impact.
With your object, like are you able to do real-time monitoring and those sorts of things that is?
Absolutely. We can do it in a very rudimentary way. We have a technology called timing area, so we can give you approximate occupancy in an area, and we can also count the time. So it's very similar to this loitering detection technology that we have. But as we have in the parking industry, we have others in retail that develop other applications and dashboards that are associated that can provide you the dwell time, the queue lengths, improve overall operation of a facility.
Thank you. Any other questions for Basil? Yes.
So we do a couple of option detections where
Do you want me to type it in again?
between a person and vehicles, so we're actually using access to counting on rats. Yeah. The vehicle and then that type of stuff. We're also doing the opposite way, so where you've got it in a lane where you shouldn't have pedestrian traffic, so we can detect pedestrian. We're also using access to the intercom points and the siren. So when someone's walking up to a window gate, we can then send that around to a private message and then the siren is then also. So getting all of the portfolio together and interfacing with us.
Thank you.
Thank you, Gary. Ari?
Another area where I conferred with Basil on was the use of a camera very cost effective to replace ground induction loops for vehicle detection and safety loops.
Do you want it on the screen now?
Yeah, specifications now, where in areas where you cannot connect loops.
Very good. No, keep going. Any questions?
Oh,
Any
go
more
on.
questions? Basil's a security rock star. How long have you been in the industry, mate?
Too long, we're on there. Yeah. Just in IP though, like in the IT world, I went across to security and surveillance because there was more money in it, to be honest. I didn't want to deal with those single digit margins in IT, so I moved over to IP CCTV, but it's been really good journey, and really exciting with the advent of analytics and artificial intelligence.
So, Basil, you'll be around a little bit later.
Sure will.
Catch up.
Yeah, absolutely.
Usually the last one to leave, so.
Yeah.
Very
Got
good.
to make that train trip home interesting, don't we?
Here you go, mate.
Everyone.